So we always hear about cholesterol, good and bad. Could you explain how these fit into the broader picture of cardiovascular risk?
Yeah, I mean, I always found the lipid panel is a great window to look at what a person's overall body metabolism is. So if we look at the triglycerides, when it's high, which is common in the South Asian population, and the HDL, the one that people call the good cholesterol, and it's low, that's often an early sign of prediabetes or insulin resistance, which diabetes and prediabetes cause cardiovascular disease at an earlier age. The LDL cholesterol, which is the one that is we're often focused on because it's the one in circulation the longest and tends to get into the arteries and cause the blockage problems, is one that if it's over 190, then we're worried about an inherited problem called familial hypercholesterolemia, which causes somewhere between a 3 to 7 times risk of having heart disease 10 years earlier. So when we have that, even at a young age, we want to start medications when the LDL is over 190, pretty much at any age. So we'll get on the cholesterol medicines, statins and ezetimibe and things like that sooner rather than later if they have a very high LDL. So the whole panel kind of is a real good window into that. Now, if your triglycerides are normal, your HDL is normal, your LDL is a little high, and then we start looking at other risk markers to decide if it warrants treatment and at what age.
Okay, awesome.